In the Lone Star State, we cherish our freedoms and hold our families dear. But when it comes to healthcare, the challenges we face are as diverse as our people. Every day, Texans grapple with the consequences of bad actors in the medical field. That's why we created Texas Best Docs. We're here to help families protect their loved ones and make informed healthcare decisions. Welcome to Texas Best Docs, where we bring you the stories and insights of the leading healthcare professionals transforming the medical landscape in Texas. I'm your host, Kalee Pair, and today I am thrilled to have a very special guest with us. Joining me is Dr. Jim Hancock, a decorated board-certified physician and Rear Admiral of the U.S. Navy, retired medical officer of the Marine Corps with over 40 years in the Navy and the Corps Chief for the Navy Medicine worldwide. He was also sent on 2 combat deployments to Iraq and Afghanistan. Join us as we explore his inspiring journey, discuss the importance of healthcare transparency, and get his thoughts on the impact of initiatives of Texas Best Docs. Hello and welcome, Dr. Hancock.
Thank you very much,
So great
Kelly.
to have you. And I see you have a special friend with us.
I do have a special friend. This is Isabel. Isabel's been with me. She's 7, and she was trained by the Warrior K-9 Connection in Gaithersburg, Maryland. And she helps with a lot of, I was blown up and shot in Afghanistan, and she helps with a lot of my injuries and things, and she's amazing, and she keeps me out of trouble.
Well, we're going to unpack a lot of your story coming up, but I'm so glad to have Isabel. You're such a good baby. Are you a good doggy?
Watch.
Yes, you are.
Watch.
Yes. Oh yeah. It's going to be really hard for me to not get distracted throughout this interview, but we're so excited to have you. We got talking before the interview, and there's just so much about you that I could spend probably another 3 hours unpacking all of it. But I want to talk about you first. I want to give you a chance to talk about your story, how you got to where you are today. What made you get involved in medicine to begin with?
My story started in the early 80s. I was, a kid from a poor family living in Mill, Illinois, and not going anywhere fast. And I joined the Navy, and I joined the nuclear power Navy, and I rose to the ranks pretty quickly as an enlisted guy. And they felt like, hey, listen, no, you're going to go to the Naval Academy. So next thing I knew, I was at the Naval Academy and had an engineering degree. Since then, I've just had absolutely been blessed. When I was at the Naval Academy, I got hurt, so I wasn't going to be able to. I wanted to go Naval Special Warfare, is what I wanted to do, or what I thought I wanted to do, and that wasn't going to be availability. So the next thing, I had very good grades, and my advisor happened to be the advisor for this new program to allow Academy graduates to go medical school. And the next thing I knew, I was off, and I was in medical school. And since then, I've been blessed, with a 40-year career. Started out as an E1, ended up as an admiral. And it was absolutely amazing. I deployed with Naval Special Warfare. I deployed with the Marine Corps. I got to fly F-18s for 5 years. I really just had a blast of a career. Emergency medicine fit me, my personality, my lifestyle. And quite frankly, the war was on, and it was highly needed. So that's my story in a nutshell. And like I said, I was very blessed with my career.
So we have to go back a little bit. Where in small town Illinois, where are you from?
Right in the middle of Illinois, a little town called Eliopolis, Illinois. It's between Springfield and Decatur. You blink and you're by it.
Okay, so I'm from Herscher, Illinois, Kankakee.
Oh, yeah?
Okay. I actually worked in Central Illinois for several years, though.
Yeah, no, absolutely.
I just had to go back there because
So
I was like,
the
we have a
cornfields,
connection.
The cornfields.
The cornfields, the bean fields.
Yep. Walking the
yeah.
summers.
Oh,
Every
yeah.
summer.
That's a really cool journey. There's so many questions that I had, other than the Illinois one that was the most important, obviously, because I'm from Illinois. But when you said emergency medicine fits you, it fits your personality. Kind of unpack that a little bit. So what was it about you that emergency medicine just clicked?
So I'll be honest with you. I did a residency in family medicine first. And I was out practicing family medicine, and I very quickly realized that for me, for Jim Hancock, continuity of care was way overrated. I was more like I wanted to treat people, and I wanted to treat them and get to know them briefly and be able to treat emergencies. That was where I found myself really drawn to. So I actually deployed. My first combat deployment was as a family physician. And what I found out was that I didn't have the skill set that I needed to be able to do trauma at the point of impact. So I was deploying with the Naval Special Warfare with the SEAL teams, and they needed somebody with a little bit better skill set. So I actually, at 40, went back to do a second residency in emergency medicine. and then came back and immediately went back to combat deployments.
And so so you could hone your tools on, right there, it happened and you can help immediately.
Yep. That has been really what defined my career, whether it was the Expeditionary Resuscitative Surgical Suite that I developed with Naval Special Warfare, or was the mobile trauma base that I developed in Afghanistan. It literally was taking combat medicine. You hear of the golden hour? We made it to platinum 5 minutes. Mm-hmm. So once the Marine or the SEAL was hurt, in 5 minutes, they could be in my hands, and I had whole blood and the ability and the skill set to be able to save their life. So moving it that far forward has really changed the landscape of military medicine. Mm-hmm. We didn't used to do that. If you watch MASH, they flew them off and the medic treated them, and then they got to the doctor, all the way back miles away. Yeah. And what we found out in Afghanistan and Iraq with the IEDs and the high velocity projectiles, the kids were dying that shouldn't have. So we moved farther and farther forward.
So, I don't know if you feel comfortable talking about when you got injured, and how the medicine and the emergency medicine kind of helped you. I mean, do you mind talking about that moment?
No, not at all. So I was in Afghanistan in 2008. If you remember, that was when the Marines were going back into Afghanistan. And I was in an area of Afghanistan called Nowzad, which was where some of the most fierce fighting there in Sangin, was where I was stationed that 11-month deployment. And we had sustained significant casualties. And so I had moved farther and farther forward. And we had developed the mobile trauma-based system, which is the ability to be able to provide a safer environment for combat medicine at the point of impact. I say point of impact. Really, we like to be about a click back from where the fighting was going on so we can get those casualties back very quickly. Mm-hmm. That day, we had moved casualties between the LZ and the mobile trauma base several times using an MRAP, and we'd gone up and down this wadi several times. And unfortunately, we got hit with a big IED. And so it caused, I had significant injuries. There were a lot of significant injuries. Couldn't help myself, but I will tell you that I had the best corpsmen in the world. These are at this time it was just men, but these men are heroic in what their efforts were. And they saved a lot of lives on the battlefield. Yeah. Including mine.
And you did that for many people as well, which is you have a lot of achievements. I mean, we listed some of them, a very small list of those at the beginning, but out of all of those, is there defining moments in your career or a couple that you can, talk about?
Well, when you spend 40 years in the military and you have all of these things, people always ask me, what's my defining moment? I will tell you that I have to bring it back to the military family. People say, what's your best accomplishment? And I say, my 2 kids, flat out, and I failed twice in the fact that they both are in service to our country.
That's not failing.
I had hoped, to save them from that, but my son's a Marine and my daughter's married to a Marine. And so they are my shining accomplishments. The military family, what the families give to our military members. Every time I'm in the airport with people thank me all the time. They rarely thank my wife. That's really where the thanks should go.
Yeah. And that kind of goes to my next question as, switching gears from you being, this decorated, Navy, Marines, everything, doctor, as a dad, as a husband, what kind of advice do you give to those families that maybe get overlooked a little bit when it comes to the military?
Well, one, raise your hand and say, you need to be accounted for. We need to help them. Right now in healthcare across the country, we're having difficulties. I will tell you the military medicine's not been immune to that. Mm-hmm. And in a lot of our remote bases, think about where we put our military bases. They're not real big populated areas, especially for the Marine Corps, right? Camp Lejeune, 29 Palms, China Lake. These are areas where they're out in the middle of nowhere, where there's not a lot of medicine. So if you take these military families, these people that have given so much, we've got to make sure we've got that healthcare there. So I would tell them to be accounted for, raise their arms, have a voice. And, my wife's a big advocate. When I got hurt, there was a lot of systems in place in order to help me, to get me back to care. Very few people were taking a look at the family. How do they do that? I will tell you that for me, the first time I thought I'd hidden all of my PTSD issues from my daughter and my son. And for my first wake-up call was when my daughter wrote her first English paper in college. And it described my screaming at night. Wow. It wrecked me, because I thought she, hadn't seen any of that. Mm-hmm. But it was front and center. And quite frankly, it's what got me to care.
Yeah. And I mean, so we need to be, when making healthcare decisions, whether it's military whether it's not, is to be front and center, raise your hand, like
That's
you
right.
said. And I think that's kind of what Texas Best Docs is really promoting, is that healthcare transparency and just standing in front of your own healthcare journey and making sure that you are, let's not hide behind anything. Hey, the doctor says it's okay. It doesn't mean it's necessarily okay.
Texas Best Docs is the doctor's best friend. Everybody thinks of the data banks and things as being a got you, but it's just the opposite. Karen and I moved here from Washington, D.C. Everywhere else I've always been, I've been close to military bases. All the docs worked for me. I knew them all. I knew their credentials. I knew if I needed a procedure, I knew the best doc in the military to be able to do that. Well, now I'm in Dallas-Fort Worth. I don't know anybody. Right. So how do you go find that doc?
Yeah.
Well, the first thing is you look and say, okay, where did they train? What did they do? I mean, I have that insight. But for the normal American, how do they look there and making sure? Now let's take that a whole nother step further. So let's say you're an employer and you're looking to, let's say you're a self-funded employer. So you're paying for insurance and you have the ability to be able to pay for that. You want to make sure you're getting, your third-party administrators bringing the best docs to your employees. And this is a way they can do that. Now let's take a look as an emergency medicine physician, right? I pretty much consult every single patient, right? They come and see me. I'm not their primary care doctor. I'm going to get them to the best care, whether that's over to you all at orthopedics, whether that's wherever that's at. How do I look and make sure the person I'm referring to is good to go? Right? That they have their credentials that I need them to have, all of those things. This is a one-shop stopping where they can look for a source and be able to look. Yes, it's going to highlight if somebody has problems. Got to be honest with you. If I'm a doc that had problems, I'm not going to hide behind that. I'm going to explain that. And this is a great platform for them to explain that, And it's amazing. People want to look and say, well, how many entries do they have in the data bank? Well, no. What is their practice? If you're a practice where you're a doctor that only takes care of the most sickest patients, some of your patients are going to die because that's what you're taking care of.
Yeah.
Now, if you're a doctor that never takes care of a sick patient and you have a bunch of patients die, that's probably a problem. So again, I think the transparency is good, and I think that the platform does that very well.
And how do you feel, as we move forward? You and I were talking a little bit about what you have going on in the future, which I want to talk about, but also, with Texas Best Docs. The change, what do you think about future of healthcare with this kind of helping to open the door to some of that transparency?
Medicine has gone through multiple evolutions throughout time, right? That have been landscape changing. So what am I talking about? The X-ray, it changed medicine. Penicillin changed medicine. MRI changed medicine. Currently we're in the area of genomics, changing medicine. We're getting to know more and more. Now with the advent of AI, we're going to be able to have an ability to really gather more information. And we need to go from treating patients to treating you.
Yeah.
Right? I need to get to precision. And I think that's going to be the next breakthrough in medicine, is the ability for us to not look and say, okay, the stack of books that I learned in medical school, which I know half of is wrong, I just don't know which half. How do I take that information and update it, but not only treat the average of what happens to 100 patients if I treat them with X medicine. I need to know what happens to you if I treat you with that medicine. And that's the next step forward. How do we surgically plan that way? Right? How do we get there? We're getting better and better at that, quite frankly. The orthopods are leading the way.
Yeah, I was going to say, what are you guys working on? Because I know this is something that you are working on right now.
For me, I'm not young anymore. So precision medicine is very appealing to me. A lot of people call it functional medicine. I like to say precision because I want it to be precision about the person. So as you get older, you get a metabolic syndrome going on. How do you do that? Why is it that in 2025 that women are still suffering through menopause? There's no reason. There is no reason for you to have to suffer through that. Why is it that you see these declines and you see people, whether it's the plaques in their brains and the plaques in their hearts? What can we do to get after that visceral fat? What can we do to get after and make them live their best life for the rest of their life? You've earned that. So that's what we're going to get after. Paradigm, Medical Group and Solutions is where I'm, my partners and I are looking at only getting into things that matter.
Yeah. I mean, and I'm seeing a lot of this myself as I'm getting a little older and I'm going to some doctors and, they don't see something and it's just like in and out of the door. And then I find somebody who's like spends 2 to 3 hours going over my labs. It's a little bit different. And I think that's the kind of quality of care people deserve.
And I think, quite frankly, whether it's 2 to 3 hours, I mean, the problem we have in the country is we have fewer and fewer doctors per population. So we've gone to extenders, which extenders are amazing, but they, you still need the whole of the group. You still need doctors, you need NPs, you need PAs, but you still need doctors. You still need people to put that time. So do they have 2 to 3 hours? The question is, do they need it? Can we use AI? Can we use things to be able to get all of those data, whether they're from your peripherals that add in, that know what your diet is, that know what your genome is, that knows what your labs are, and it puts it in a format where that doctor now can make that decision and you can have a meaningful conversation in minutes, not hours.
Yeah. I mean, that's amazing. I'm looking forward to seeing how kind of that all works out. And, I want to talk, I'm going to go back to, you being a father to your children. They don't live around here, right?
No. Okay. My son's stationed in Camp Lejeune, North Carolina. Yeah. My daughter's husband is a Marine fighter pilot, and he's a test pilot, and they're in Pax River, Maryland.
So I think that the reason I asked that question is because I think a lot of times, just like you said, you moved to Dallas-Fort Worth and you didn't know anybody. I also moved to Dallas-Fort Worth and didn't know a lot. And I have a parent that lives in a different state that I'm trying to help out as well. In that regard, not maybe a physician outlook, what kind of advice would you give to your children on using Texas Best Docs to be able to make sure that the care that they're getting is the best care that they can? Now, they have you, which is great to help them ask the right questions. But if they didn't,
I think it's in everything in today's world is an informed consumer is a better consumer. So healthcare, you're a consumer of healthcare, and that's a wonderful thing. So educating yourself about not only the doctor, but the facilities that they're using, what is the reputation and numbers. So Texas Best Docs, what they do is they give you part of that equation, right? That you can get after in a hurry. Mm-hmm. I would also say that in today's medicine, if you don't have an advocate, it's time to get one.
Yeah. Number one. I mean, I think that puts the nail on the coffin there. You have to have an advocate. You have to have somebody. And I think there's a lot of people out there who don't.
I would actually say to a certain extent, Texas Best Docs is an advocate, right? They're advocating for the patient. So it makes it's the first chance to get after data. And again, the docs shouldn't be afraid of this. They should embrace this. This should be their calling card, free advertisement.
Yeah. Well, I want to make sure that anybody who's watching or anybody who is at home and has just heard you say that, where maybe you don't have an advocate, that Texas Best Docs is your advocate. You need to be looking at this, and you can go to texasbestdocs.com and find out more information and get signed up. It's such a minuscule amount of money to be able to have that background and that support that maybe we didn't have before this was created. So, I could talk to you all day. I think that you're so fascinating. And Isabel? Isabel?
What you think?
Hey, thank you for coming today. Thank you for coming on our podcast. I have just enjoyed this. I'm excited about what you bring to the healthcare industry and now to my life, because I feel like you've already given me so much in the short time that we talked outside. Thank you again for coming here today.
It's good to meet you, Kalee, and thanks for having me on.
Yeah. To our audience, thank you for joining us on Texas Best Docs. We hope that you found this episode both informative and inspiring. And again, as we said, if you don't have that advocate, please make sure that you're looking to Texas Best Docs. And if you have any questions, you can always put them in the comments below. We have so many more stories from the front lines of healthcare. If you go to our YouTube channel, we've got several other interviews with amazing physicians and doctors across the state of Texas. Don't forget, again, the website is www.texasbestdocs.com. Should be pretty easy to remember. You can get started with finding the best healthcare for you and your family. And as we said before, you can stay informed. You can have that advocate for less than a Netflix subscription. So if you have any questions or feedback, feel free to reach out to us through our website and follow us on social media at Texas Best Docs on all social platforms. And if you have any kind of topics that you would want covered or any questions that you would want answered in a future podcast, please also leave those. You've been listening to Texas Best Docs with Kalee Pair and Dr. Hancock. If you enjoyed it, and Isabel, can't leave her out. If you enjoyed today's episode, please subscribe and leave us a review wherever you listen to your podcast. And again, as I said, any questions or things that you would like answered, we would love to hear from you. Until next time, take care and stay healthy, Texans.